As a result of a CMMI innovation grant, we've developed a unique approach to care coordination. It starts with a data platform that aggregates big data. It takes data from the Delaware Health Information Network, which is a robust HIE. Most of the patient information in the state of Delaware finds its way to the DIN. The data platform also takes data from our clinical systems. It takes claims data, community databases, and eventually will take data from home monitoring devices and wearables. It aggregates the data, creates a patient longitudinal record, and it also uses artificial intelligence and predictive analytics to help us understand which patients are at risk. Our care coordinators sit in our Center for Virtual Care, and they get alerts in real time so that they're able to contact a patient who may be starting to experience some difficulty and actually change the trajectory of care, caring for them at home, in the community, rather than waiting for them to come to the emergency department or the hospital. And what's particularly unique about CareLink in our virtual hub, it's not just nurses doing care coordination. We have physicians, pharmacists, social workers, and we'll be adding nutritionists and eventually behavioral health specialists. We also think that behavioral health is a key factor in success in caring for a population in a world of value-based payment. So we have long integrated behavioral health therapists into our service lines, but approximately a year ago, we reorganized, and our primary care practices now all have behavioral health therapists embedded in the practice. And in fact, several of our practices also have addiction counselors. So we're treating mental health problems and substance abuse right where patients come to us in their primary care medical home. We're very fortunate at Christiana Care. We have Dr. Terry Horton, who is an addiction specialist and also an internist, and the creator of another unique program called Project Engage. This is a partnership with Brandywine Counseling. We bring peer counselors to the bedside of patients who may be admitted for pneumonia, heart failure, but also have an addiction issue, and in that moment may be ready to start to address their addiction, their substance abuse, as they recover from whatever acute illness brought them into the hospital. We've implemented this program for the last several years and have been able to demonstrate that this approach gets more people directly to treatment and therefore more people who are successful with their treatment. So we're also actively expanding that program currently to our high-risk mothers and babies. Neonatal abstinence syndrome is another significant outcome as a result of the opioid addiction. And while we want to care for those babies who are born with neonatal abstinence syndrome, we know it's equally, perhaps even more important, to care for their mothers who are addicted in this new innovative approach. So we are participating in several Medicare programs, including an accountable care organization, bundled payments, independence at home. These are all shared savings programs. But we're also looking for partners in the state of Delaware who will help us move to full risk. We're interested in moving to capitation, to total cost of care, so we can create a system of care delivery that truly delivers on our promise of optimal health and an exceptional experience for all of the people that we serve.